Good afternoon, everyone. We are back. We have fixed our technical problems, and we are joining Chatham County Commission Chair Al Scott as he has called a news conference to update us on the county and what we're doing as far as COVID-19. Right now at the podium, we're listening in to Dennis Jones, who is the director of SEMA.
Are banned unless you can keep a 6 feet distance apart from each other. In addition to this executive order, as part of this amendment, the chairman is also further emphasizing that any person having a fever or showing other symptoms recognized by the CDC as indicators of COVID are required to seek immediate medical attention and follow the direction of their primary care physician. All such persons are also required to self-isolate for 14 days until cleared by a medical professional. Additionally, persons having serious underlying conditions who are likely to develop complications if they contract COVID are ordered to isolate or shelter in place within their homes or place of residence. This order shall include the following populations: persons who live in a nursing home or long-term care facility, persons who have chronic lung disease, persons who are currently undergoing cancer treatments, and any other person who is identified in the public health administrative order that was dated March 22nd, 2020. So again, this amendment will be signed today by the chairman. It will go into effect today. And in addition to that, there's a few other updates that I'd like to mention. Governor Kemp did request from President Trump that Georgia be issued a major disaster declaration. The President of the United States signed that major disaster declaration for the state of Georgia yesterday. That put in place emergency protective measures, allowing municipalities and county government to implement any emergency protective measures they deem necessary to combat the spread of COVID-19. It also allowed the federal government to provide direct federal assistance, which means that any resources of the federal government can come in and augment or provide support to the local government. In addition to that, several other allowances have been made throughout the country. SBA has issued a disaster declaration for the state of Georgia. If you have any questions about the SBA declaration, you can go to sba.gov. There's also some allowances with unemployment. You can go to dol.georgia.gov for a list of those allowances. I want to reiterate a few comments that Dr. Davis had mentioned. He mentioned the total case counts in Chatham County and throughout the state. Please keep in mind that these case counts are a snapshot in time. They are collected information as of noon this morning. They will be updated. The numbers will be updated again at 7 p.m. tonight. And again, that's a snapshot of the confirmation tests that have been reported to the Public Health Department. So that's not an indication of all of the confirmed tests in Chatham County right now. There are still many out there. There are still some that are being reported to public health. That's why they are updating those numbers twice a day. As Dr. Davis mentioned, it's very important that we prevent the further spread of this through social distancing, maintaining that 6 foot space between yourself and others. Governor Kemp, again, issued a mandatory shelter in place for those people who are sick, and we mentioned those just a minute ago, those persons who are living in a nursing home, have chronic lung disease, undergoing cancer treatments. So it's very important that those people adhere to that order. We've had many questions about calling 911 2681. The number again for the state of Georgia coronavirus hotline is 844-442-2681. The county has also set up a disaster website. It is a clearinghouse for information where you can go and find out information about your municipality, about the school board, other significant activities around the county. That website is ready to go, and it is called ready.chathamcountyga.gov. Again, that website is ready.chathamcountyga.gov. Inside that website is also an interactive map. You can click on that map, you can type in your address, and it will tell you which emergency declaration or which Particular restrictions are in place for your specific address, or if you are planning to go to a doctor's office, or you have some other significant appointment for an essential function, you can put in that address as well. It'll tell you what the emergency restrictions are in place based on the location that you are interested in. Health and medical issues, we are working day and night with public health, 7 days a week, to mitigate any unmet needs from not only the hospitals, but from public health, from personal care physicians. We've been talking with nursing homes, long-term care facilities to address any unmet needs. We're also working with community partners to make sure that the needs of our most vulnerable populations are met. Logistics, we are continuing to work with the state to get personal protective equipment in Chatham County. It is slow, but they are arriving. As you can imagine, personal protective equipment there's shortages throughout the nation. It's not unique to Georgia or Chatham County, but those supplies are coming in. They're just coming in very, very slowly. With that, we also put out a press release last week that talks about rumors and scams. It also ties back to the state of Georgia, and information is collected on a regular basis within the Emergency Operations Center, and we will continue to put out information about recognized rumors and also recognized scams that are either advertised by the state of Georgia or that we are seeing locally. Okay? So with that, I'm going to turn it over to our County Attorney, Jonathan Hart, to talk about.
Before you turn it over, would you also encourage people, if they know of price gouging, the Attorney General has a hotline for that, and they really need to report that.
Sure. Part of Governor Kemp's declaration originally issued was the enforcement of price gouging to make sure that anyone who is actually price gouging the citizens or the governments, you can report that to the state of Georgia. I don't have that number here in front of me, but I will get that and make sure that's available before you leave today.
Make sure
You
it's
can
on
advertise
that.
that. Pardon?
Make sure it's on that website.
And it will be on our ready.chathamcountyga.gov website. So we'll make sure that gets posted here within the next few minutes. Okay? So with that, County Attorney Jonathan Hart to talk about what an emergency declaration is and is not.
Thank you, everybody, for attending today. I'll be very brief. There seems to be some confusion about emergency declaration and its contents and its meaning. First of all, emergency declaration is basically defined under the Georgia Emergency Management Act, and it does include pandemics and influenza, public health emergency where there's widespread exposure to a disease. So we're clearly within that. The powers within that act, the powers are delegated down to the political subdivisions of the state of Georgia, which would include Chatham County, obviously. The powers under the act are to be liberally construed. And the governing body of Chatham County is the Board of Commissioners of Chatham County. And the Board of Commissioners of Chatham County basically have an ordinance that parallels the Georgia Emergency Management Act. And under that act, the chairman of the county commission has the authority to declare a countywide emergency, state of emergency. And the only triggering event to that is the filing of the declaration with the clerk of council. Now, what is in that declaration is countywide. That does not mean that each municipality in the county cannot tailor things that they need to add to or be more stringent in how they plan to manage it locally. It is well recognized that each municipality has its own unique issues. And as a result of that, throughout this entire period of time, there has been great collaboration between the county and the municipalities. I think in any type of disaster, any type of emergency such as that, cooperation and coming together and reaching a conclusion together is probably the most important thing we can do. And I think that is very well demonstrated by the attendance we have of all the mayors today. So I'd like to make sure that everybody understands that what we're doing here today is countywide. It's not just within this unincorporated county. If each of the cities decides they would like to go a further step and wish to issue their own disaster declaration to further define that, we have no issue or quarrel with that, because we're all in the same boat together. Thank you.
If there are any questions, you have to identify who you're asking the question. We got the mayors of all the municipalities are here. The only mayor is not here, he couldn't be here the 23rd.
I have a question for Dennis. I don't know if we're at that point right now. You would know, Dr. Davis would know, or is there any plans of opening up mobile hospital sites, i.e. maybe the Civic Center or another location?
The state of Georgia has done quite a bit of investigation throughout the state. We have been working with them on a regular basis to talk about what would happen if a hospital does reach capacity. So there are plans that are being put in place to do that. As of right now, I don't know what those plans, I don't know if they've been finalized, but I know that we are working on that. As recently as yesterday, I had conversations with people up at the State Operations Center, and my staff have made contact this morning to try and get our hands wrapped around what the logistics are of doing so, but there are plans that are being put in place in order to do that. Fortunately, we're not there yet, so we still have a little bit more time to put that in place, but there are strategies that are being worked out to do that.
And Dr. Davis, there are stats that you have been so tirelessly collecting from the Coastal Health District. You said there's 46 cases right now that we know of, more to come, because testing is 5 to 7 days. Are there any documentation or any stats of people who have gotten the disease and recovered?
Well, that's a good question, and I don't have an exact number of the people who have gotten it and recovered, but we're fortunate in that we've had no reported COVID-19 related deaths. So at the moment, barring those who are still in the hospital and perhaps in intensive care, the ones that have been told to isolate at home, all seem to be improved.
This will be a question for Dennis as well. How quickly can we see some of those checkpoints at the airport, the bus stations? How quickly can we see those be up and running across the county?
Our limiting factor right now are getting the personal protective equipment in place. It has been ordered. Some of it will be here within the next few days. Other parts of that, or critical parts of that, will be toward the end of the week. So I'm hopeful that we'll have all of our personal protective equipment in place by the end of the week, and we'll be able to start doing that this weekend. But it's all going to depend on shipping. So as soon as we get the PPE in, we'll put those screening measures in place.
Can you talk a little more about the logistics behind these measures at these checkpoints? You know, the supplies needed to do things like take temperature, what the questionnaire is actually going to ask people, what should people expect when they come into these?
Sure. What we're actually looking for is a temperature of 100.4 or higher. So that's going to be the first and foremost trigger for us to take another step. So everyone who departs the terminal, whether it be on a plane, train, or bus, they will have their temperature taken. And we're looking again for that 100.4 degree temperature or higher. From there, they'll then move over to another area within that terminal to where they'll be asked a one-page questionnaire about their travel history. And we're going to collect information about a phone number in order to be able to get into contact with them. We're going to give them a flyer about self-isolating, and then they're going to be able to go on their way. We don't have any means at that point or any reason to contain them within that terminal at that point. We'll have staff follow up with them the next day and the following day to see if they did see their primary care physician, to see if there's any additional information that we may need to follow up on. So everyone who comes through a terminal, we're going to ask them to have their temperature taken. Again, that 100.4 is the magic number. If they have that or higher, then additional information will be collected from them to follow up with later.
Is there a number, an initial number on how many people you expect to be testing as they come into this area? Is there a rough estimate even?
There is. The airport is obviously the largest location where we'll be having staff. The airport normally has several thousand people come through there each day. Right now, the numbers are around 600 to 700, I believe. And the bus station and also the Amtrak stations, they're considerably lower than that. I think the Amtrak station had 2 trains that came in over the weekend each day. So, and again, limiting factors with the trains is we're trying to encourage them to have the social distancing as well. So all the occupancies on the airplanes, the trains, and also the buses are lower than normal also.
Say somebody does travel somewhere, they're coming back, they go through the checkpoint, they're fine the day they get checked, the next day they're feeling sick, they're feeling the shortness of breath, any one of the symptoms. What is the best course of action they should take? Maybe you or Dr. Davis could answer that.
Like with anyone, if you become symptomatic, first you should assume that you have COVID-19 and act in a responsible manner. You should then contact your healthcare provider, describe what's going on, your symptoms, and any physician or licensed healthcare provider in Georgia can actually go through the system to get a person under investigation number. If there's not a local facility using a private laboratory where they can be tested, they can be referred through the public health specimen collection center. But there's a process to go through that.
Okay.
But they should act as though they have it. They should stay home, self-isolate, and contact their medical provider.
So using any one of those telehealth options, apps, stuff like that is probably preferred?
Well, there are several of those out there, but once you use one of those, if they screen you positive, so to speak, you need further care, you still should contact your local provider.
This could be for anybody really in the room. Has there been any communication with state officials about any type of massive, larger shelter-in-place initiatives, anything larger than what is already in place right now? Any?
I was on the phone call this morning with the Georgia Municipal Association, with the state's 535 cities, 538 cities, and mayors about asking Governor Kemp to do something more substantial and something that is more coordinated than what we have right now.
Do you want to speak to that, please?
There has been discussions at the state level, and as Mayor Johnson mentioned, through Georgia Municipal Association and also ACCG. As many of you know, Georgia is a home rule state, so the governor is allowing as much as possible for the local officials to make decisions for their local governments. There isn't a plan, excuse me, there isn't a plan right now to issue a statewide shelter-in-place order. I'm sure that is something that the governor has available to him if he chooses to do so. But as of right now, I'm not familiar with an order that the governor will be issuing that.
Dr. Davis, prophylactically, are patients or doctors prescribing to patients the chloroquine, Zithromax, and now we're even hearing plasma therapies?
I'm sure that that's going on. I think that the FDA just recently approved the use, outside of an experimental protocol. There is really not a whole lot of data that it does work, but there were some, shall we say, encouraging nuggets of information just in a few isolated places that it may help. And so, yes, I'm pretty sure that some of the physicians are prescribing that.
Dr. Davis, I actually had a question too. Is there is there an expectation of how many cases could be in this area before it eventually does get better? Is that something that you know? Is that something that doctors can even predict?
If you heard Dr. Fauci on national TV, he estimated there could be up to 200,000 deaths, and he's trying to put that in a sort of a medium situation. There are doomsday predictions, and then there are people who downplay it. Roughly, it appears, and this is again all rough numbers, but it appears that about, let me back up another step. Let me give a news. I thought you might ask this question. This is, and please be aware that this is purely numbers and speculation. This is in no way science. This is taking some things that are out there and projecting. Influenza typically infects about 10 to 20% of the U.S. population each year. But we have some degree of what we call herd immunity, and that's herd like a herd of cows, not like I heard it through the grapevine. Because people have gotten a flu shot, or they have some lingering immunity from a previous infection. Unfortunately, we have zero herd immunity to COVID-19. We are all susceptible. COVID-19 seems to be at least as infectious or contagious as influenza. And so it's reasonable to assume that with no herd immunity, we may have 40 or 50% of the population contract COVID-19. There is no herd immunity. It also appears that roughly 15% of those infected with COVID-19 require hospitalization. And it appears that COVID-19 is about 10 times as deadly as influenza. The death rate with influenza is about 0.1%. That means the death rate with COVID-19 is probably around 1%. And this is a moving target. As we test more, we'll have a better picture of the number of asymptomatic cases. So if you were to apply those numbers to Chatham County, and this is more of a doomsday proclamation and in no way should be taken as gospel, our population in round numbers is 300,000. 50% infected would be 150,000. 15% hospitalized would be 22,500, and 1% deaths would be 1,500. And the problem with this, and the reason we talk about flattening the curve, is that with no herd immunity, this is all going to be, or could be, compressed in a 2 to 3 month period. And that could easily, totally overwhelm our medical care capacity. If we do what leaders here are proposing, and if people act in a responsible manner, and if we socially isolate, I sincerely hope, like Dr. Fauci believes, that we can significantly lower that number.
Where can people go? This is also a question for you, Dr. Davis. Where can people who do not have a primary care doctor, may not even have insurance, say, God forbid, they develop some of these symptoms, where can they go if they don't have those primary care?
We have 2 federally qualified health centers in Chatham County, and I know they're seeing people, and we've had referrals to our collection sites from them. And then we also have several urgent care centers, and those are the ones that I would recommend.
Doctor, we're hearing nationally that the peak, according to the president, is going to happen around Easter with state of emergency through the end of April. When do you see the peak in Chatham County, if there is one in sight?
I really wish I had a crystal ball. Again, our first cases were diagnosed about a week and a half ago. It usually takes 3 or 4 weeks before you even really take off on the exponential growth phase. So I would say we should be, if it's going to get as bad as it possibly could, that would be in about another 4 or 5 weeks. And then how hot we burn, I don't know.
Are there other measures maybe going forward? You know, it's constantly changing all the measures that you put in place to keep people safe. Are there things that you're looking on down the road that could be?
My hat is off to the leaders here for what they're doing. At some point in time, people have to take individual responsibility. They can put all the rules and regulations they want in place, but if people ignore them and continue to congregate, what's the point?
Father, you speak to the issue. I see it as having a pipeline of people who have been tested that have not been reported back. So you expect the numbers to go up. At least I expect the numbers to go
Yes.
up. Can you speak to that?
Yes, as I said, these numbers that we have, 46 confirmed cases, that's what was happening 10 days ago. There are a lot of other people who have been referred for testing. Those tests are still outstanding, and we're still using very strict criteria in this area because we have limited testing capability. So the true number, we really don't know. I do know that this has been the busiest day for reported cases in Chatham County or in the Coastal Health District today. We had more new cases reported today, some of which are not reflected in these numbers because I don't know which county they live in.
This may be a question for either you, Dr. Davis, or any of the officials here.
Don't give it to one of the others.
Say somebody is handicapped, does not have access to transportation, and they either need supplies such as food, they want to get tested, they may think they're sick. What resources are available from the county or even some of the different municipalities represented here today? What options do they have to be able to try and get help for them?
There are resources that are available for anyone who is having transportation issues and they feel that they need to get to their primary care physician. I know Chatham Area Transit is running a modified schedule. They also have paratransit buses where they can carry people who are wheelchair bound. And if there is an immediate need outside of their normal route, where it is really imperative that they get to a primary care physician, they can contact the Emergency Operations Center and we'll ensure that transportation is arranged for them.
Dennis, would you also speak to the fact that there are plans in place if we get to the point where we're asking people to isolate in place, and they might be in a home with one bathroom, kids, they cannot isolate home, so the plans that's in progress for that?
Sure. There are several locations that are set up throughout the state, and we are also setting up locations within Chatham County so that those people who are confirmed with COVID-19 and they are asked to or required to self-isolate, if they cannot do so in their own home because they have a large family or they have a limited number of bathrooms, there are locations for those people to go. So we do have those set up in the state, and we're setting those up in Chatham County right now. So again, those are provisions for someone who is not comfortable sheltering in their own home because of a large family or a limited number of bathrooms. We have locations for them to go for 14 days or however long it takes for them to recover from COVID-19.
Where are some of those preliminary
I'd
places?
rather not say.
Gotcha.
Quite honestly, we don't have them set up locally yet. We're exploring several options. The state has several options that are available to them right now. Those are really very limited as to the criteria for who can get into those. It has to be coordinated through the Emergency Operations Center and Department of Public Health. So I just don't want people just showing up at those locations expecting to get shelter. Again, there's very certain criteria that has to be met in order for them to be able to seek refuge there. Real quick, I know you probably have more questions. I committed to giving you the number for price gouging with the Attorney General's office. That number is 1-800-869-1123. Again, 1-800-869-1123. And again, that number will be posted on our disaster website, ready.chathamcountyga.gov.
You also just mentioned briefly, you can't just go and say, I want to be tested. You have to be referred. You can get a referral through the Chatham County Health Department. If some people are actually go to the Chatham County Health Department for various medical services, and if that's what you're currently doing, you could get referred by.
Currently, we're focusing on some of our core, what we call protective services, like treating those with STDs, family planning services, so when we finally come out of this, there's not another population explosion. So birth control is important, immunizations and vital records. We are actually not screening people for COVID-19. If somebody, in fact, we're screening people before they come into the health departments. But any physician or licensed caregiver anywhere in the state can make a referral to the specimen collection center that we're running. So that's how the system works. And there's a way they go online, they answer 2 or 3 little easy questions, and then they'll generate a number that goes into an electronic queue. We call the people and give them a time to show up to have their specimen collected, so we don't congregate people unnecessarily. And so that's how it's done.
Dr. I had a question. You said that the numbers now are kind of a snapshot of what was going on maybe 10 days ago. Since opening some of those multiple sites here, the specimen collection centers, like you said, is there a more exact number on how many people, how many tests that have added to the area? Do you have that?
Well, here in Chatham County, we're running between 30 and 32 people a day through our collection sites. And again, those are people who meet very strict criteria at this point in time. They are healthcare providers, first responders, who may have been exposed or who have symptoms. They are medically fragile people, or they're people who are caring for medically fragile people who may have been exposed, basically. So it's not just anybody who wants to be tested can come be tested. There are some promising movements on the horizon with some private companies that I'm sure you've read about. Abbott Labs is coming out with one of those quick, inexpensive, reliable things that can give you a positive diagnosis, I think, in 7 or 8 minutes, and a negative one in 13 minutes. Hopefully that'll be online within a week or two. There's some other things that are gearing up this week that we hope will come online by the end of the week or early next week that will significantly boost our ability to broaden the screening efforts. The reason some people may want to, let me just say, the reason we make such a point about protecting the healthcare workers and that workforce and the first responders, just because we're in the midst of the COVID-19 pandemic, does not in any way mean that people quit having heart attacks or strokes, that first responders are responding to fires or trauma, major trauma. So those things that require our healthcare resources every day are still going on, and probably to just about as great an extent as they always are. So what's related to COVID-19 is above and beyond on top of that.
A question was asked earlier, if there was any intentions to have a mandated countywide stay-at-home. The answer to that is no, at this point. But there may be some mayors here who might be contemplating that, and I welcome you to ask them questions. We do have at least 2 municipalities that have the mandate stay-at-home and also implemented curfews. So those are still options that the mayors are looking at if you want to ask those questions to specific mayors.
Okay.
No other questions? Final word. We collectively, those behind me, we realize that there's quite a bit of public anxiety about COVID-19. There's quite a bit of fear throughout our community. The leaders standing behind me are committed to your safety. They're committed to ensuring that we are doing as a community and as individual governments what we feel is appropriate in order to protect you from this virus as much as possible. A lot of resources are being put in place. A lot of coordination efforts are being conducted around the clock, both at the state level, at the county level, and also at the municipal level. So this is a managed response to this event from all the mayors, all the elected officials standing behind me. They are very committed to ensuring your safety, but we can't stress enough the importance of self-policing, okay? And what that means is it's very important that, one, you're washing your hands on a regular basis, and also you're maintaining that social distance. Dr. Davis mentioned just a little bit ago some staggering statistics that he got from a doctor from Emory, I believe it was it? And those numbers can drastically be improved if you just maintain that social distancing, keep yourself 6 feet away from another person, and also maintain your hand washing and your personal hygiene. That will dramatically help to reduce the spread of this virus throughout our community. All right, thanks everyone, be safe.
And you have been listening in on a news conference with Chatham County Commission Chairman Al Scott, as well as mayors of Chatham County's municipalities. We saw Savannah Mayor Van Johnson in the background, Dr. Lawton Davis of the Coastal Health District. We saw Dr. Ann Levette of the Savannah-Chatham County Public School System there, also Sheriff John Wiltshire, SEMA Director Dennis Jones. One thing that did come out of the meeting is that the purpose of this news conference is to issue an amendment to the original declaration of emergency, which goes a step farther for people. One thing that Dennis Jones mentioned is that there are right now 46 confirmed cases in the Coastal Health District, 16 confirmed cases here in Chatham County, but the total case count is just a snapshot in time, he said. There will be an update tonight at 7 o'clock with newer numbers, and it's important to prevent the spread of COVID-19 through social distancing. Something else that came up during this news conference is that travelers by week's end will have to go through checkpoints as they come into town through the bus station, the train station, or the airport. They'll undergo a preliminary test where their temperature will be taken and they will be asked a number of questions as they arrive into town. Now, they're looking for folks with a fever of 104 degrees or higher, or who are showing symptoms. Those people will be asked to contact a physician and to self-isolate. Also, a couple of numbers and a couple of resources have been set up for folks with questions. There is a coronavirus hotline that has been set up. That number to call, 844-442-2681. There's also a website, ready.chathamcountyga.gov, with lots of information for you. As far as price gouging is concerned, there's also a number set up for individuals. If they think that someone, a business, is price gouging, that number 800-869-1123. Right now, plans are being made to open mobile hospital sites if the hospitals reach capacity. At this point, there is no mandated countywide stay-at-home order. Once again, keep it right here on WSAV and on WSAV.com for the very latest. Thank you for joining us. We'll have more information for you tonight on First News at 5. We now return to your regular programming. Have a great day.